I'm working on my second book, which will also be called GAPS, but this time it will be Gut and Physiology Syndrome, which abbreviates as GAPS as well. And here we will talk about all the so-called physical conditions which are related to abnormalities in the gut flora and to the digestive problems in patients. And here we will be talking about all autoimmune conditions, because autoimmunity is born in the digestive tract of patients. We'll be talking about multiple sclerosis and rheumatoid arthritis and diabetes type 1 and various other autoimmune conditions. We'll be talking about arthritis, all sorts of arthritis. There are various diagnostic boxes in this area. We'll be talking about conditions where people have no energy, which is ME, chronic fatigue syndrome, and fibromyalgia. And we'll be talking about chronic cystitis and various other physical conditions which are related to the state of the gut flora in these patients. What happens in autoimmunity? The abnormal flora which grows on the gut wall damages it and makes it porous and leaky. The gut wall in these patients is like a sieve. So various foods that people eat do not get the chance to be digested appropriately before they're absorbed. And many proteins that we consume are very similar to the proteins in our own bodies. When they absorb partially digested, in a biochemical shape and form which is inappropriate for the body to use, the immune system finds them there, looks at them, doesn't like them, and starts developing antibodies against them. And then these antibodies, which were developed for the food particles, cross-react and attack our own tissues, our own cells and our own proteins in our own bodies. Usually the patients, the research in this area has been quite extensive, and we know quite a lot about it. We know that patients with all sorts of autoimmune conditions and patients with autism and schizophrenia and rheumatoid arthritis and many other conditions already have got many antibodies in their bloodstream against their own tissues. The typical antibodies that we find are against their myelin, which is a fatty substance which coats and insulates every nerve fiber and every nerve cell in our nervous system. And the damage to this substance, to myelin, is the essence of multiple sclerosis. We see a lot of symptoms typical for multiple sclerosis in autistic individuals and schizophrenics and many other individuals with so-called psychiatric conditions. We see antibodies against various fractions of collagen in the bodies of these patients. Collagen is a protein which holds our bodies together, and it is particularly densely present in the joints and in the muscles. And when the body develops antibodies against this particular protein, the person gets arthritis. Initially, it may be a condition called migratory arthralgia, when the person wakes up one morning with a pain in the knee. Next day, the pain in the knee has gone, but now an elbow hurts. The day after, it may be small joints in the hand that are hurting. The elbow doesn't hurt anymore, so the pain migrates. As the bunch of toxins accumulates in one particular joint, and these toxins come from the digestive tract, the immune system comes along and cleans them out. But as the toxicity keeps coming in, it settles in some other joint. So every day the person will have a different pain. That's the mildest end of the spectrum. But as the situation gets more and more serious and the person becomes more and more toxic, the situation escalates and the body starts producing antibodies against those toxins. That is one mechanism. Another mechanism is the toxicity coming out of the gut. Various toxins, and we already know that acetaldehyde does that, and some other toxins produced by particular species of microorganisms in the digestive tract. When they get into the bloodstream, they like attaching themselves to various proteins in the body. And as they attach themselves to those proteins, they change their three-dimensional biochemical structure. Again, the immune system comes along because immune cells race around the body all the time, surveying it. They find these altered proteins, look at them and say, "You're foreign, you're not mine," and starts developing antibodies against those proteins. So your own immune system starts attacking your own tissues. So these are two mechanisms. When the proteins in the pancreas are being attacked in such a way, the person develops type 1 diabetes. When myelin is being attacked in the nervous system, the person develops multiple sclerosis. When fractions of collagen are attacked in various joints, the person develops rheumatoid arthritis. When some other proteins are attacked around the body, the person may develop lupus or some other autoimmune conditions. So autoimmunity is born in the digestive tract, And that's what the treatment has to concentrate on. I have quite a few patients with type 1 diabetes, children, in my clinic, who through the GAPS nutritional protocol managed to pretty much get rid of their type 1 diabetes. The injections of insulin first reduced in the dose drastically, and then the patient moves into a stage when they have occasional injections of insulin as a prophylactic measure, and then eventually they can stop it altogether. Allergies, again, are born in the digestive system, and that's what my new book will be concentrating on as well. Allergies are a part of gut and physiology syndrome because, again, the damaged and leaky gut lining causes the immune system to react to foods which are not being digested appropriately and cause all sorts of allergic or food intolerance symptoms in the body. Another thing that happens, various researchers place between 80% to 85% in the gut wall. So our digestive system is a major immune organ in the body. The largest percent of our immunity is located in there. And there is a very tight relationship between the gut flora and the immune system. The gut flora plays a role of a balancing agent between two major arms of the immunity, Th1 immunity and Th2 immunity. Th1 arm is responsible for normal, appropriate reactions to anything in the environment. That is why the agents of Th1 are present in all our bodily secretions, in tears, in saliva, in sweat, in all the secretions on our mucous membranes, inside our digestive tract, on the skin, on the eyes, everywhere we're in contact with the outside world. And this arm of the immunity is kept up to its job and kept healthy and alert by well-functioning gut flora. When the gut flora is damaged and when it's abnormal, this arm of immunity becomes disabled. It cannot function. So the second arm of immunity, called Th2, which is normally responsible for all the immune work inside the body, inside cells, inside the liquids of the body, has to compensate for this disabled brother. And it becomes hyperactive. It cannot react appropriately to the outside world. It reacts to the outside world in an allergic way, in an atopic way. So the person suddenly starts reacting to everything in the surrounding environment in an allergic way. So people say, I've never been allergic to anything, and suddenly I became allergic to my perfume, or to my mascara, or to my deodorant, or to milk, or to my cat, or to my dog, or to pollen. I developed hay fever. When the immune system is out of balance like this, the person is reacting to everything in the environment in an allergic, inappropriate way. In order to bring these two arms of the immunity back into appropriate balance, we have to restore the normal gut flora. We have to concentrate on the digestive tract of the person. And unfortunately, the way our medical profession is trained at the moment, they're not trained to do that. So patients do not get appropriate treatment for these conditions. In fact, GAP syndrome, gut and psychology and gut and physiology syndrome, is a very appropriate name for this syndrome because these patients do fall in the gap in our medical knowledge, and as a result do not get appropriate treatment.